Dr. Gaurini, there's a disease called sickle cell anemia?
Yes. That's actually a disease, again, another genetic disorder where the hemoglobin is affected. This is somewhat different than what we just discussed, where instead of having where there is a very specific mutation in the hemoglobin that changes the chemical characteristics of this very central molecule in the blood, and because of that, all kinds of problems ensue. This disease, again, the genes come from someplace, and in this particular situation, the genes are the gene originates in Africa, in essentially Central Africa, and then from there has moved to the Mediterranean basin to some degree. There is some level of sickle cell present in areas like, for instance, Saudi Arabia, and then obviously there is sickle cell present here in the United States and in a number of other countries where African genes have moved over time. So it is a fairly common problem amongst African American or individuals from the Caribbean islands who have African ancestry. The overall, contrary to thalassemia, where probably the numbers are measured in hundreds to a few thousands here in the United States, there are probably about 100,000 patients with sickle cell disease here in the United States, and many people who carry the trait, obviously. This is a, you may have heard about the so-called newborn screening. A drop of blood is obtained from the newborn to check for a number of genetic disorders. And one of the genetic disorders is actually checked for is the sickle cell disease. And the reason why we want to know about sickle cell disease at birth rather than a few months afterwards is because one of the major concerns early in life with sickle cell disease is infections. And all babies with sickle cell disease are detected at birth, and they are essentially started on antibiotics, simple penicillin, to prevent infection very early in life, in the first couple of
months. What kind of infections are they prone to?
Their infection, there are bacterial infections that are typically pneumococcus is which is one of the bacteria that is involved in giving people pneumonia. But in this particular group of patients, since they can handle it well because of spleen problems that ensue in this particular disease, becomes what we call sepsis, an infection of the blood, where that can be potentially lethal and very rapidly. And there are very good studies that have shown that the use of penicillin during the first 5 years of life essentially almost completely prevents that problem.
Do they get infections involving the joints sometimes?
They do, although it's not the most common problem in this particular
more of an arthritic type of reaction?
Yeah, what they tend to do is they actually have bone problems, but their bone problems are more related to what is so-called sickle cell crisis. And the sickle cell crisis shows itself in different ways. For instance, the infant often has what is called a hand-foot disease because the bones in the hand and the feet swell up, and they're very painful. And obviously a little baby who cannot communicate well will be very cranky or very irritable without a true reason, and occasionally you see the swelling in the hands and the feet.
So these patients should be immunized against pneumococcal disease?
Absolutely. The advent, they have been immunized against pneumococcal disease with something called the pneumococcal vaccine, which was not conjugated. That was given at age 2. Now there is a pneumococcal vaccine that can be actually given much earlier, and it started at about age 2 months. with a complete immunization by the age 1 year. It, at the moment, is not yet clear whether or not this immunization so early will eventually eliminate the need of putting this patient on prophylactic penicillin. There is no study available at this time, and since the prophylaxis with penicillin is essentially free of complication, the moment all patients with sickle cell disease should be on penicillin.
Penicillin prophylaxis has been done for about 50 years now, hasn't it?
The prophylaxis with penicillin, it's close to that. I mean, it's been for a very long time. There was a very big study in the very early 80s that essentially established it as the way to go for this particular disorder. And one of the things that it is important to notice is that kids with sickle cell disease used to die very commonly prior to this, while instead death in the first 20 years of life in patients with sickle cell disease is fortunately a rare event. It still exists at a level that are higher than the general population, but it is a rare event.
So besides giving penicillin and giving the kid a vaccine against pneumococcus, what other things can you treat?
Well, there are many things that one needs to do. For instance, one of the most devastating complications of sickle cell disease is something called a stroke. The sickle cell disease affects the blood vessels, among other things, and young kids with sickle cell disease may have stroke. There is a significant incidence of this problem. A stroke is essentially a plugging, an occlusion.
And what can we do to prevent that complication?
Well, interestingly enough, in the last 10 years, a lot of study has gone into this, and there is very good evidence, very good studies that say that measuring the blood flow in some critical blood vessels in the brain through something called a transcranial Doppler, which sounds terrible, but it's a very simple and non-invasive procedure. It's essentially an ultrasound of the blood vessels, and we do ultrasounds for all kinds of things. That actually gives us a very good idea whether or not a person is at risk for the stroke or not, the patients with sickle cell. And those patients who are at risk will actually decrease their risk substantially if they are put on a chronic transfusion treatment. So transfusions in those patients actually are the accepted way to essentially reduce or negate the risk for a stroke.
So if they get a lot of transfusions, do we still run a risk of getting iron built up in the body?
Yes, that's the downside. Unfortunately, as in life, in medicine, there is no free lunch. So
and we have a way of getting the iron out of the body.
And these patients, once they go on chronic transfusion, will require what we call chelation therapy, which is essentially therapy to reduce their iron in the blood, in the body. And with the new chelators, also patients with sickle cell disease can benefit from that. And we are actually having very good results in sickle cell disease as well as in thalassemia with the new oral chelators.
And down the road, bone marrow transplant is a...
Bone marrow transplant is already a possibility in sickle cell disease for a variety of reasons, and because the disease is so heterogeneous, meaning it has so many different manifestations, and it's so benign in some patients and so devastating in others, has not been used across the board for these patients. But we know that patients with sickle cell disease can be cured of their disease with bone marrow transplant, and there are at this point probably several hundred patients who have been transplanted both here and in Europe. A little anecdote: the first patients with sickle cell disease who was transplanted actually was transplanted because the patient had recurrent leukemia, and the patient happened to be treated and cured of both sickle cell and leukemia, and I believe she's still alive today, many years from.
So it's great hope down the road with this disease.
It is great hope.